So the way that we're gonna do it is to get every single one of you practice on recognizing a rhythm. I think one of the things that we're not doing very well is that when we're in the room, everyone kind of talks over each other. So this time we're gonna split up into groups of 2. So you guys are gonna go in with a buddy and we're gonna run you through different scenarios. Each scenario has 2 rhythms that must be identified. So one of you will take the first rhythm, you will pick your interventions to do. As soon as you do a couple of right interventions, we'll proceed you to the next rhythm, and then the next person should be able to identify the rhythm and know what to do next. Does that make sense? Okay, so if you guys want to follow me over here, I'm going to do a quick reorientation of the mannequin, because we are still having some issues with it.
Have we come up with a name yet?
Johnny Sims. You get it. Anyway, so this is our friend. He is awake, right? Remember that all of this is interactive for you. So if you're seeing your patient be in a distress type of thing, remember your vitals. You know, I'm not going to give you vitals. It is your job to get a blood pressure cuff, to make sure that the leads run so that you can identify things. If you want a cycle of blood pressure, you just have to touch, and then you tell it to start right there. So that's pretty easy, and then everything else should make sense here. Remember, I'll read you the scenario right now because everyone starts with the same scenario, but there's different things that happen, right? He is going to be attached to Telly for our purposes today. Remember over here that your crash cart, you should know what's in your crash cart by now, and use it appropriately. Remember that these little white guys are our pads, right? So when you're thinking about shocking our patient, if you need to shock, you have to attach these friends.
Where?
Yep, they're there. Remember to turn on your defibrillator. Sounds stupid, but people are forgetting to turn it on. And if you need more information, remember that you can pop that open so that you can manually change things for this person. Does that make sense?
Mm-hmm.
Okay, let's move outside. I'll read you the scenario and then pick a buddy that you're gonna be doing this with. All right, so your scenario is as such. This is for everyone, right? So you are on the GI consulting service with a co-resident, pre-rounding on your patients on the 4th floor when a CNA steps out of the room, alarmed, asking for help as a patient she was watching is not doing well. The patient is connected to telemetry and she says there's a funny rhythm on the screen. Okay? All right, who's going first?
We're 2 in first.
I
know what we're doing.
Everyone's gonna have a different scenario, remember?
We're in space.
So, just so for clarification purposes, remember that as soon as group 1 is done, the scenario resets, right? So you're not picking up where they left off. Does that make sense?
Can we watch?
No. You're staying out here because we're gonna use the scenario several times because everyone should be able to identify all 6 of the rhythms that we're trying to do, okay? Give me 1 second, I will tell you where to go. Okay.
Put it together there. It's nothing personal.
No, it is.
It's a little personal.
I can't vote for you.
And can't be friends. It's hard for me to do this. Not really. It's with some of the pieces. Women break faster.
There's HM and Uba, please go ahead.
Okay.
Your patient is, we can turn on the leads, sorry. This is your man.
That's not good. Do I start now?
Yep. Start anyway.
So that's not a good rhythm. Beat it? I mean, it's not like a
It's smaller and, yeah, big. Okay, question I have is, does this correlate with this?
Okay, so
Or is
this
this one
is your,
different than
this is your rhythm,
Okay,
this is your clap.
SPO. Okay.
Okay. What, do you wanna know about the patient right now?
The patient, they say is not doing well, it's on telemetry. I would like to know the vital signs.
He's
But
80
it's
over
telling me
60
that
with
it's
a max
only
of 60.
over 50 with that, so, and 85. So the
I mean,
blood pressure is low, and does she have a pulse?
does he
How
have
are you
a
gonna
pulse?
know?
By checking.
The pulse is 177. But I can't feel the pulse of Johnny since. And so, but SVT's with her because of the rate being so elevated, so we could just cardiovert
What is your rhythm?
the rhythm of it.
Ventricular,
To me, I just like tachycardia of the ventricle. So,
Okay, so it's ventricular tachycardia,
yeah.
and he's hypotensive.
Mm-hmm.
What do you wanna do?
That's what I don't know. Maybe we could shock him.
ventricular tachycardia.
Might be a good idea.
Just shock him.
The rhythm just changed.
Oh, the rhythm just changed.
Yeah,
Oh,
it's
great.
sinus.
No,
Sinus sac. Scenario complex.
Push analyze. Analyzing now. Scan clear.
Alright, now what do you got?
now you shocked him.
Analyze.
Okay, great.
Stand clear. Push to shock. Start CPR.
Oh, we're not doing CPR. That's unfortunate for this
Is
guy.
that all?
Why aren't you doing CPR?
Because we need to lower him down to bed. You can do CPR now.
Stay there.
Mm-hmm.
Yeah.
Let me know when.
What's your plan from here?
Just shock again.
Oh, we check after 1 minute.
No. To get CPR, you get 45 seconds.
Okay, friends, I'm gonna give you some clues. Keep doing CPR.
Yeah.
So what is the rhythm that you guys identified?
So ventricular tach.
Okay, so according to the ACLS algorithm, what are you gonna be doing?
Besides doing CPR, we already have pads on him. He's gonna shock
Okay,
him in
good.
6 minutes.
Good, any interventions, any other interventions that you would like for a patient in VTAC?
Not that I can come up with.
You shocked once,
Yeah.
what's gonna be your next thing that you're gonna do?
Shock twice.
Okay, and then after another shock, what else are you gonna do?
I would say, don't we just keep shocking with the shockable rhythm?
Any medications that you would like to give the patient?
Want to be Ramiodarone
Why amiodarone?
or epinephrine.
Push
Okay, how much of epinephrine would you like to give the
Wait, stand
patient?
back. Stand back.
How much? How much of that?
0.5.
1 milligram you mean? Okay,
Wait, stand back.
Stand clear. Push to shock.
okay, we shocked again. Alright, so resume compressions, 2 minutes, and then we're gonna do 1 epi. Good job.
Do we actually have to draw off the epi?
You don't have to draw it, we'll just pretend.
Okay.
You shocked, the second shock,
Mhm.
you're still in ventricular,
VFib, yeah.
VTAC.
Yeah.
So you're gonna give epi
Yep,
and circulate it for 2 minutes.
2 minutes, yep.
And then
Okay,
Alright,
so you're gonna give epi now.
I'm giving
That's the
epi,
second shot.
so.
Okay, epi in. Good. Alright, do you wanna analyze your rhythm?
Analyzing
So
now.
you've circulated for 2 minutes.
Mm-hmm.
Alright, now what do you got?
No shock advised.
What is this rhythm?
CPR.
He's
Just
asystole.
like-
Good, perfect. So what are we doing with an asystole? CPR, yes, continue CPR, good.
You're a little low on your sternum, okay? So you wanna be in the mid portion of the sternum,
Mhm.
okay? At a rate of what?
30.
No, what is your rate for compressions?
Oh, it should be like 120.
100,
100.
Aggressive.
okay?
Okay, and your patient's dying, Dr. Ruba, because you have not been doing compressions on this patient. Good. And of course, you have a very friendly respiratory therapist that is bagging you. Good. All right, think ahead. Think ahead, Dr. Ruba, what else are you gonna do? Okay, perfect. How often are you gonna wanna do epinephrine?
Every 3 minutes.
Every 3 to 5 minutes, good,
Okay.
good.
So let's say you've done 3 minutes, you're checking your rhythm. What is,
Analyzing now. Stand clear.
you don't need to
To
turn on the
analyze,
defibrillator.
Advise.
you can just look at your EKG.
What is your rhythm?
It's still asystole.
Okay, so what are you gonna do now?
Another epinephrine.
Another S.
Good,
Okay.
So another epinephrine.
good.
Dose of epinephrine.
And you got somebody over there working on it.
Then,
Good.
so it's maybe 15 and then 2.
Is there anything else you would like to know about this patient, my friends?
What's your code status?
Full code. Good. Anything else that you would like to know about this? Remember, this is not your patient. This is somebody that's a bystander. What do you want to know about them? They're on 4th floor.
So why is this patient in the hospital?
Perfect. The patient is a 57-year-old male with past medical history of ESRD on hemodialysis. He's here for treatment of left lower extremity cellulitis. He was started on Bank and Rocephin last night. Is there anything else you would like to know?
Any allergies? Is it?
No allergies.
Okay.
He's been here for a whole day. Anything else you would like to know?
Dr. Rubin, that's not effective CPR.
No, the bed is too high for me, I need to
Well,
bring it down a
then-
little
then
more.
let's
Let's adjust it, okay?
That's the moving thing.
Okay. Anything else you want to know about this patient?
Maybe I need, can I get that to stand
Sure.
Step stool in there as well.
Thank you, Dr. Campbell.
Yeah, I got that.
Anything else you would like to know about this patient, doctors?
What other medications is he on?
Vancomycin, he got a dose of Lokelma last night. Would you like to know his labs? Good. His labs is sodium 132, potassium 6.4, chloride 108, bicarb 15, B150, creatinine 6.7.
So can we
Did
give
you
a
say
shot of
potassium
calcium?
6.4?
Yes.
Okay, so
You want calcium for what reason?
To lower the.
to protect the heart.
Good. Okay, so we're gonna do 1 of calcium.
Okay, cool.
Perfect.
Just imagine me, I'm taking medicine. Okay, calcium's in.
Okay.
Is this patient scheduled for dialysis today?
He is scheduled for dialysis tonight. He has not received dialysis.
In the meantime, can we give maybe saline with insulin to
Good.
bring down the potassium?
Good
Perfect.
idea.
How much
Where that
insulin would
is.
you like?
I would say 10 units.
Great. Anything else you saline? You want saline or do you want a different fluid?
It's gonna be D5, I believe.
Okay, we can do D5. How much D5 would you like?
Let's start with 250.
Okay, that sounds fine. We'll do the 250. Any other interventions that you would like for this patient?
We would like, sorry, we would like to draw a lab.
Good. Good. We'll do rainbow labs.
Rainbow Lab.
All right, Dr. Uba, you have been coding this patient for 1 hour. Would you like to do one last rhythm analysis?
Yes, please.
And it's still asystole to me.
All right. Do you want to call it, or is there anything else you would like to do for this patient?
Is family around?
No.
Push analyze.
So,
That's it. We're gonna call it.
Call it
We're not gonna give her.
Yeah, do the other one.
Okay.
Yeah.
Couple of things, the most important thing when you see somebody and they're hypotensive and VTAC is to try to get some circulation.
Okay.
You delayed a long time starting CPR. I think you were trying to